Hi everybody, I'm Dr. Olivia Joseph and welcome to this week's live Q&A. So I have 3 excellent questions that I'm going to expand upon, as well as give you some information on how to get more extended resources when it comes to questions more specifically around autoimmune disease and things of that nature. So I'm going to talk about that at the end of the video. But the 3 questions I have are scenarios that many of us can relate to. This is a 62-year-old that has over the years been diagnosed with hypothyroidism, osteoporosis, increasing exercise. You've kind of given up on the entire healthcare system. You've decided you never want to put your body through that type of trauma again. You don't want to take medications because of side effects, the huge costs which continue to increase, and you don't resonate with this as part of your background. So your question is what is a good screening tool for you to keep an eye on your health? You don't know what your blood pressure is, your cholesterol is, and you know that one of your 4 children is compound heterozygous with MTHFR, meaning you and your husband are essentially both carriers. So here's where we are. One thing you need to consider is for the best screening, whether or not MTHFR is affecting you or not, is homocysteine. Homocysteine is a great marker of inflammation, and it measures inflammation in your blood vessels as well as in your brain. I think it's a very important marker to keep an eye on. It's estimated that about half the people who die of cardiovascular disease, heart attack or stroke, have normal blood pressure, normal cholesterol. Now, as you know, you can watch your blood pressure and monitor at home. So that's a screening tool you can do at home, and it's going to be more accurate than having it checked once every 3 months, 6 months, or once a year at the doctor's office, because if you get nervous when you're there, plus it's just one reading, versus when you're home, you can monitor it several times a day. That's one thing that I do actually with my own father. I have him monitor his blood pressure several times a day. As far as what your blood sugar is, if you do a full blood panel, you don't need to see a doctor to do that. You really don't. If you go to drolivia.com, click on labs, you can run a comprehensive panel that'll show you a fasting glucose, but more importantly, I really like to see a hemoglobin A1C, which is a 12-week glucose average. And you want to see that that's below 5.7, 5.2 is the sweet spot. You can order additional testing like insulin. I don't usually do that if the A1C is in an optimal range. You can check your blood pressure yourself. You can check your own cholesterol or lipid health. But I find markers that are very, very essential to keep an eye on are nutrient markers like B12, folate, homocysteine, C-reactive protein, vitamin D, iron, ferritin. Because all of these affect your energy levels, how much oxygen is getting to your actual cells, as well as risk factors for things like cardiovascular disease. So those are things that I like to keep an eye on. I was interviewed for a podcast on MTHFR this week, and the 2 doctors that were interviewing me were like, we don't even know what MTHFR is. And I was cracking up because they weren't sure how many people would understand this topic. And I said, you would be surprised. This is a topic where I find the general public tends to be more educated than the healthcare system on this topic specifically, which is sad but true. And I think the most important thing to understand about MTHFR is you got to keep an eye on homocysteine. You really do. It's more important than knowing if you're compound heterozygous or homozygous, in my opinion. That's what you want to keep an eye on. The other thing you want to keep an eye on is that you're not taking nutrients that contain synthetic folic acid, that you have enough of the right form of cobalamin to absorb folate. Keeping an eye on things like that, as well as your estrogen detoxification and metabolism, mood, energy, things of that nature, that's going to be a better predictor of health than high blood pressure and high cholesterol. So the next question I get is, can I use probiotics if I have gastritis, specifically acidophilus? If you go and watch every video I have out there on gut health and probiotics, you're going to see none of the probiotics I recommend are acidophilus specifically. Now, Lactobacillus acidophilus is not bad for inflammation in the colon. How do you know if you have inflammation in the colon? You check fecal calprotectin levels. That's a great screening tool. It's such a good screening tool that now they're working on creating at-home fecal calprotectin tests prescribed by your doctor, covered by insurance, instead of a colonoscopy, because a colonoscopy generally is done once every 5 years, not until you're over 50, and sometimes a colonoscopy is a great tool because you get to take a look and see what's going on, but if it's only done once every 5 years, that's a long window of time, and cancer can easily develop in that time frame. So what they're finding is a fecal calprotectin is a great screening tool for inflammatory bowel disease as well as colon cancer. So as far as probiotics for gastritis are concerned, gastritis is in the stomach. Probiotics don't live in the stomach. So I'm never going to recommend a probiotic for gastritis. If you have gastritis, I'm going to recommend something like the appropriate digestive enzymes, getting tested for H. pylori, using things like L-glutamine, deglycerized licorice. Those things are going to be so much more effective. Even doing a food sensitivity test to identify what foods are creating this inflammation, pulling those foods out of your diet while you do something such as the appropriate digestive enzymes. With gastritis, be careful of digestive enzymes that contain betaine HCl because it can flare up gastritis. But if I see somebody taking betaine HCl, which is very beneficial for some people, and they get gastritis, a bigger thing I want to take a look at is, do they have H. pylori, which is a bacterial overgrowth in the stomach that can cause gastric ulcers, cause stomach cancers, and not only that, trigger the most common autoimmune disease, which is Hashimoto's. So the next question, love this question. I was wondering the pros and cons to treating SIBO with meds versus natural. So according to research, the effectiveness is equal regardless of which approach you take. So the most common medication protocol is using Xifaxan and neomycin. The most common protocol that I use for SIBO is using something called Candibactin AR and BR. Another effective tool naturally is using something called biocidin. And I'm totally brain farting. There's another supplement out there. It's not physician-only formula, and it's been tested to inhibit SIBO from growing back. So it's not the best antimicrobial for killing it off, but once you've done a couple rounds of treatment, it's good at keeping it from growing back. And if I think of it, I will let you know, but it's not one that I stock, so I'm not really, it's not coming to my mind right now, but it has been tested, and it's actually recommended by a lot of gastroenterologists. So back to the natural versus the medication. The effectiveness is equal, but when you truly have SIBO, you usually have to treat more than once, and here's why. Because bugs like bacteria, yeast, viruses, even parasites are very smart. They create what's called a biofilm around themselves to protect themselves and make them impenetrable to medication or supplements. So we have to use something called a biofilm disruptor. And biocidin has a biofilm disruptor, and so does Candibactin AR. So this biofilm disruptor disrupts the membrane, so whatever treatment you're using can actually get to the infection. So yeast and bacteria, you often see those things go hand in hand. They are not the same thing, but it's very, very common to see that you have both. So the crazy thing is bacteria can live in a yeast biofilm. Yeast can live in a bacterial biofilm. We know this about H. pylori. H. pylori loves to live in the biofilm of yeast. So what that means is H. pylori is a bacteria. If you take an antibiotic or an antimicrobial approach to killing that H. pylori, you will do so successfully, but you will not successfully get to the bacteria that's hiding inside the biofilm, which is why you can get reinfected and you don't know how, or why it never really goes away completely. So I'm a big fan, if you're going to go whether the natural route or the medication route, usually it requires treatment more than once. So when I work with someone, obviously I'm using natural tools, and I will treat somebody on an average of 2 to 3 times or put them through a protocol that I've designed custom to them. If somebody does end up on medication, that's okay. I still do follow-up work with them to do a repeat protocol and program using the appropriate antimicrobials, using the appropriate biofilm disruptors, and even something called binding agents if and when necessary. So the question here is, do medications have more die-off occurring, or do the natural treatments have more die-off occurring? So what die-off is it's called a Herxheimer reaction. It's when yeast or bacteria dies in your gut. Well, it can take 3 days before all of that moves out of your gut. So what ends up happening is you can get very, very bloated. Sometimes you feel sick, achy, brain fog, headaches, nauseous, belching, burping, diarrhea, indigestion. Doesn't that sound fun? So what you can use is you can use a binding agent. And the binding agent I use the most is probably activated charcoal. You just have to be careful not to use activated charcoal when you take your supplements or when you take or during a meal, because it will block the absorption of those nutrients. So that's definitely something to consider. What I love to use, especially for yeast, is Saccharomyces boulardii. You hear me talk a lot about that. It's called Ultraflora Acute. It's a Sac boulardii probiotic. And Sac boulardii is technically not a probiotic. It's actually a type of yeast. But I call it the Pac-Man probiotic, because imagine you're swallowing Pac-Man and it goes in and feeds on all those white dots. What it's feeding on is the die-off that can occur, which is called a Herxheimer reaction. So Sac boulardii is very, very effective for that. And for those who need it, I'll use activated charcoal, but that's really only about 10% of the population. Some people that get really, really, really bad diarrhea, then you want to consider like bentonite clay or diamostaceous earth, something of that nature. So that's all the information I have for you on SIBO, natural versus medication. Best test for SIBO still is a breath test, but I was just on the phone with a client doing a consultation this week, and the one thing I said to him was I would still do a stool analysis before I do a breath test, because a stool analysis is going to give you so much more information. It's going to show you that person's digestive enzyme needs. It's going to show you if they have an overgrowth of yeast, bacteria, parasites. It's going to check things like zonulin for leaky gut. It's going to check calprotectin levels. So I would rather start there. I would rather start with a food allergy test. And speaking of all this gut health, I'm actually being interviewed this evening on a live Q&A session with Autoimmune Secrets, which is a docu-series that I was one of the doctors that was interviewed on. So what I'm gonna do is I'm gonna actually record it on my screen so that I can then upload it to our YouTube channel, and we'll share that YouTube link with you guys on Facebook as well. So it's probably gonna be a pretty long interview. They schedule me for an hour Q&A because they have an audience all over the world with hundreds of thousands of followers. So I'm going to answer as many questions I can about gut health, autoimmune health during that 1 hour interview this evening. I will be recording it so we can share it with you, but because it's such a big file, we'll have to post it to our YouTube page. So if you don't follow us on YouTube, make sure you do. That's where we have a video library of all these videos. We also have all of these FAQ sessions hosted on YouTube. So that's where you're going to get all of the information that we've ever done recordings on. Make sure you subscribe to our channel so you don't miss any of those updates. If you follow us on Facebook, make sure you like our videos so that when we do go live, you can be alerted that here we are answering your questions. And if you do have questions that you want me to address on the weekly FAQ, make sure you post those in the private Dr. Olivia Naturals VIP page. That's where you post your questions, and then I answer them once a week, almost always on a Thursday. So your questions are awesome. This week, every week, I love what an educated demographic you guys are. So it's always a pleasure. I love working with you guys, and as soon as I get that big file from tonight's interview loaded, I'll be sharing that with you as well.